How soon after upper eyelid blepharoplasty can you diagnose someone with ptosis? I had upper eyelid blepharoplasty exactly 10 days ago. I noticed that right after the surgery, my left eyelid looked different from my right. It was more swollen after the surgery, so I thought that could be it. However, the swelling has gone down, and my eyes do not look the same. They close and feel just fine. I'm trying not to freak myself out over something like this so early in the healing stages, but is it too early to tell if this is ptosis? How easily can this be fixed if this is the case?
Thank you for your question. You're asking how long after eyelid surgery can you diagnose someone with ptosis? And you describe in your question, which you submitted with 2 photos, that you underwent blepharoplasty about 10 days prior, and you noticed that the left upper eyelid appears to be lower than the right. And as you state in your question, you don't want to freak out, but you want to know whether or not this is ptosis and how soon is it possible to correct. Well, I can certainly share with you my perspective on your current situation, of course, without the benefit of a physical examination and other relevant data. But a little bit of background, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Eyelid rejuvenation and complex procedures, including ptosis surgery, is a significant part of my practice, and it is certainly a concern when it comes to appropriate strategy for surgery. So what do I mean by that? Well, to begin with, it's very important to understand that it is normal for patients to actually look at their eyes or any part that they have been operated on with great detail after a procedure is done. And that includes whether it's surgical procedure, a non-surgical, injectable, laser. People look at themselves through a much more detailed view and will often notice things that they didn't notice before. And that brings us to basically an important part of your follow-ups. When we do surgery, we see our patients typically after 1 week to remove stitches, or even if we're doing like lower eyelid blepharoplasty without sutures, we still see them at 1 week, at 1 month, at 3 months, 6 months, and then the door is always open for the patients to come in for any issues. And then we see them, of course, after a year. So there's a lot of opportunities to continuously monitor progress. Now, that being said, I think I would suggest before you determine that you have ptosis, you look at your pre-operative photos. A lot of times people won't realize that they had a certain degree of difference between the 2 eyes prior to surgery. And that's important to at least appreciate as a normal anatomic reality. Essentially, within the normal population, if the eyes are within 1 to 2 millimeters of each other in height, that is generally perceived as normal and not unusual. And as I often say, is that we are beautifully imperfect, and that is part of the reality. Now, as far as whether or not there has been a development of ptosis after eyelid surgery, well, in certain situations, people may have had a certain subtle difference between the 2 eyes where there was essentially an early amount of ptosis, or basically an attenuation or thinning of the levator muscle, and then after eyelid surgery that ptosis can become a little bit more accentuated. Again, as far as the relative proximity to the surgery is concerned, I would say that it is important to allow for healing to really fully transpire. When people have, let's say, resolution of a certain amount of swelling at 10 days, it isn't 100% of the swelling. And there is a lot of remodeling and workings going on behind the scenes. When you think of a wound healing model, there is certain specific phases of wound healing. And at 10 days out, you're barely past the inflammatory phase of wound healing, and now you're going through what's called the proliferative phase. And the proliferative phase is the phase where there is new collagen being deposited, blood vessels are being formed, and there's still a dynamic process. Beyond the 1 month, there's the collagen and tissue remodeling process. Generally speaking, we take a lot of our photos unless there's otherwise specifically labeled. Basically, your before and afters are generally at least 6 months apart. And that is just part of the reality. Yes, we can get our patients to look really good in a week and then good weeks later, and very often timing with work and social events, that's great, that's presentable. But then there is healing process to be continued. Once you've reached the 6-month point and you feel that there is a certain level of difference and this can be documented, then you may want to discuss any options for ptosis repair. But prior to that, I think it's very important to review your photos. What I often do is I'll actually take the photos or the before pictures, put them up on the screen, and then at different stages I'll put the after photos, and patients are able to appreciate the difference and as well as appreciate also areas of swelling that they may not really realize until they see what they looked like before. So it's always an educational process. So review your concerns with your doctor and understand that this is not your final result. So I hope that was helpful. I wish you the best of luck. And thank you for your question.